I started noticing my hip pain. I got to the point where I couldn't get around. When I was working out in my shop, I could work for 30 or 40 minutes, and I have to sit down for 30 or 40 minutes.
My name is Dr. Trio Tran. I'm an orthopedic surgeon. Typically, the patient who comes to see me tells me they've been having hip pain, either in the groin area or on the outside of their hip, not in the buttock, but on the outside. And they tell me, yeah, I've been having pain, I can't walk very far. Sometimes the pain shoots down to the knee, to the kneecap level, and sometimes that gets mistaken as knee pain, but it's really refer pain from the hip. Also, they can't sleep at night. Usually arthritis causes you to have achy pain at night. Okay, so what's hip arthritis? Everyone knows your hip is a ball and socket. So arthritis just means the ball and socket is worn out. So on the ball side, we replace that ball with a metal ball. On the socket side, we put a metal cup with a plastic liner or a metal liner inside. How you position on a table, it varies from surgeon to surgeon. So what I do when I do a hip replacement, we make a cut, we expose your hip. For the socket side, we expose the socket side, we clean up the socket side, then we size it and we put a metal cup in. After we're done with that socket side, then on the femur side, the ball side, we remove that ball, we size it, and we put a metal ball with a metal stem attached to it, and we put that into the thigh bone, the femur bone. I will slide the prosthetic femoral head into its acetabular component, test the movement of your new hip joint, and verify that it is properly positioned with an x-ray. I will then close the joint capsule, repair the muscle, and close the incision with stitches or staple. You will be in some moderate discomfort for about 1 to 2 days, but usually after a week, most of the patients are pretty much comfortable, and typically about a month after the surgery, they're pain-free and they're back to walking.
The afternoon there, they got me up right away, and I was walking around there. I didn't have very much pain, hardly any at all that I remember. And these nurses passed me in the hall were telling me, "Oh, you're doing really great."